As you know that the conduction system of the heart that causes the atria and ventricles to contract contains the SA node, that is the main pacemaker. The conduction is then carried to the AV, yani atrioventricular nodes, and then finally into two branch, that is right bundle branch and left bundle branch, that is known as the bundle of His and Purkinje fibers. So today we are discussing about the AV block, and that is atrioventricular block. The block occurs at the level of the atrium and ventricle uh, on the atrioventricular node. So the definition is that partial or complete interruption of impulse transmission from atria to ventricle. There is a partial or complete uh, interruption, and based upon this AV block is divided into three categories: first degree, second degree, and third degree. We will discuss later on. Now first, to start with, let us discuss about the causes of this condition. The first cause is congenital, means by birth there is a defect in this conduction system. Second cause is idiopathic, fibrosis and sclerosis, means the fibrosis of this conduction system, that is idiopathic without any cause. Then there is drug toxicity. Certain drugs causes this problem, like digitalis, beta blockers and calcium antagonists. These are the three drugs that may cause some conduction system block. Rheumatic fever is a disease where this problem occurs in the ischemia, means that is loss of the blood supply or disruption of the blood supply, such as in angina and myocardial infarction, the diphtheria, an infection, and the aortic valvular disease. There are certain aortic valvular disease, some inflammation like rheumatoid arthritis, sarcoidosis, and Retter's disease. There are certain tumors affecting this conduction system, and the syphilitic heart disease, the heart disease caused by the syphilis. There is endocarditis, sometimes it is known as the subacute bacterial endocarditis. There is some problem with the muscle like dystrophic myotonica, and the cardiac surgery. The following cardiac surgery, some problems may occur in the conduction system. So these are certain causes. Now, as I have told earlier, that based upon the partial or complete interruption of impulses, the AV block may be divided into certain categories or types. The first degree atrioventricular block is often asymptomatic, means you may not have any symptom, but on and off there is dyspnea, means difficulty in breathing, weakness, and dizziness like lightheadedness. And on ECG examination, you will see the prolonged PR interval as well as the narrow QRS complex. This is the first degree. The second degree AV block may have palpitations, means conscious feeling of the heartbeat, maybe weakness, dizziness, syncope. Syncope is a condition that is sometimes the patient may fall down like transient ischemic attack, or like bradycardia, means slower heartbeat, or arrhythmia, means irregular pulse. The second degree AV block is further divided into certain subcategories like MOBIS 1, MOBIS 2, 2 into 1, paroxysmal, and higher degree AV block. So I am not going to discuss the individual variety over here, but you should know these are the certain types, and based upon the ECG findings, we can conclude the different types of these second degree AV block. The third degree AV block, the patient may experience symptoms such as fatigue, dizziness, lightheadedness, and chest pain may also occur. There is asystole, there means and complete, it is known as the complete AV block. There is a complete atrioventricular block, and patient may have atrial flutter and atrial fibrillations. Regarding the investigations, The laboratory investigations, one should look after the hyperkalemia, means the presence of excessive potassium into the blood. The troponin test for the ischemia, nowadays TROP-T test is performed. The thyroid function test if thyroid is involved, and Lyme titer for any infection, and the anti-nuclear antibody for connective tissue disorders to rule out the underlying cause. Regarding the ECG, ECG is important where we see the PR interval, QRS and RR, and 24-hour Holter examination for any arrhythmia or any other abnormalities. Echocardiography is a good test, and if we want to assess the effect of exercise, then it is always good to have the stress echo. Regarding the treatment, the pharmacological treatment is performed in case of milder to moderate degree, like atropine, isoproterenol, and dobutamine is given, but uh, under the supervision of a specialist. And finally, if there is a bradycardia and there are third degree block, then one should go for the pacemaker placement, and the pacemaker surgery is done to supplement and to increase or give the rhythm to the heart. Thank you very much.